So, Dr. Sandler,
Sir.
you can cure depression and anxiety.
Yeah.
I want
The
your
only I just gave a little talk about what I'm also a counselor. I'm floating around out there now, both in our profession and amongst the general public, is that everything is a chemical imbalance of the brain driven by genes. And you've heard me rail against this for years, because there's no research to support that at all. No research at all. There's plenty of research.
No research to show that it is all genes.
Correct.
Right.
Correct.
Yeah.
Right.
Yeah.
The research says there's a role of genes, but the research, most of it has been done in depression. Most of it has been done with twin studies. So there are these big twin registries where twins sign up, and they can be studied for the presence or absence of different problems. So if twin A has depression, what are the chances that twin B has depression? If it's an identical twin, that is, they share 100% the same DNA, what are the chances? So if it's a straight genetic disorder, the answer should be 100%, which it is with the lung disease cystic fibrosis. If you have an identical twin with CF, the other child has CF, period.
Yeah.
With depression, if you have an identical twin with depression, the chances are 30 to 40% that twin B will have depression. And that's including studies that consider older people. Because if it's only young people, you could say, well, you didn't wait long enough for twin B to get depression.
Yeah.
But even if you wait and study older people, it's about 30 to 40%, which means, on the other side of the coin, there's a 60 to 70% chance that twin B doesn't have depression and will not get it. So to say it's all genetic is nonsense. It's just a myth.
Yeah.
It's really like people read some of the studies and said, oh, it's genes. There's a genetic tendency, which there is. So that's why I say...
So you're saying that there is a tendency, because it's not that you're kind of disputing that there is a genetic tendency. Some people might have...
There's a genetic component.
Yeah, but it's not that it's there's no genes.
Right.
Yeah.
The problem, of course, is people have looked for the depression gene and discovered there isn't one depression gene. Researchers are now saying there may be thousands of genes that contribute to depression. So we're not going to get a simple answer to this anytime soon. Otherwise, we could do a blood test and say, well, you have the gene.
Right.
So psychotherapy is not going to be as helpful as it might be for the next guy.
Yeah.
But clearly the research says it's not all about genes, and the bigger contributor to depression, and the same with anxiety, is the environment. What happens to you? And that's why I say we should do psychotherapy. But then we have to step back and say, what does this say about an individual person? Is it possible that the next person coming into my office has a lot of depression genes, more than 99% of people out there, and that his or her depression is mostly due to genes? Is that possible? Well, sure. And that's why we have to, without a blood test, we have to just keep an open mind, do a good evaluation, and if there's something in the patient's life that needs to be worked on, work on it, and then see how things go. But we don't know who has a lot of depressogenic genes or anxiolytic or anxiety-provoking genes, and who doesn't. We just have to do the evaluation and proceed.
And that's a hard question to answer for the researchers too, and they're working on that. This is if you remember, in the 70s we used to have this classification of depression: endogenous and reactive. So they were on this line that there are some depressions which are more psychological, which are reaction to events, and there are some biological, which we call endogenous. But later on they found out that what looks like reactive might turn out to be endogenous, and what looks like endogenous might turn out to be reactive. So that's why in the DSM they said, okay, let's forget about it. It's major depression.
Right, but then now there's been an assumption, again unsupported by the research, that everything is quote quote endogenous. Everything is due to genes and a built-in chemical imbalance, and that's the part that I rail against. And I feel bad, especially for young people who are given that impression. A 20-year-old college student should be told, you have depression and your mom had depression, therefore you're going to live with this the rest of your life and you have bad genes? Well, we don't know that. We don't know if there's anything wrong with his genes. It's just unfair.
Well, it is. I think that there is a reason to it too. I think the big reason is that medicines work for some people.
Yeah, sure. Oh,
And,
sure.
There's an analogy, which I'll give, is that erectile dysfunction, ED, which we treat so much, there used to be a whole system of therapy. It was the Masters and Johnson's techniques of, we used to. I worked with that technique, and we would see that not only the ED would be resolved, but in general, the couple would have a more closer relationship through those techniques. But in comes Viagra, and that technique is out.
Yeah.
There's no one. It was a cumbersome technique. Everyone had to come in once a week for an hour for several months, and but now you give them Viagra, it's fixed. Same, I think, goes with the why this biological theory caught on is that people, you take an antidepressant, and in 3 weeks or 4 weeks you're back and smiling, and so it's easier.
Which is fine.
Which is fine. Yeah.
Which is fine. I hope nobody thinks I'm anti-meds.
Right.
I use plenty of medications.
Yeah.
I'm just against this misinterpretation of the research.
Yeah. So Dr. Sandler, you can cure depression and anxiety.
Yeah.
I want your
I just gave it